Hi, I'm Kristin Gratz, and I'm the Clinical Director of California START San Andreas. I'm very excited to share with you the analysis of initial referrals and highlight how we have used this data to shape the interventions from a tertiary care perspective. Our program began taking referrals in October of 2019. We are currently serving 90 people, and the majority of the individuals enrolled in our program are adults. This slide further details the age demographic of the population we are serving. The mode age is noteworthy in that it represents transitional periods for children transitioning from child to adolescence and adults from older adolescence to adulthood and adult services. The majority of our referrals for both adults and children were due to reported aggression, which is similar to most START programs. However, there are a few pieces of data that are noteworthy. Specifically, self-injurious behavior is higher than average in children, and suicidal behavior and suicidal ideation is very high for children and adults compared to the national average. Keep this in mind when we look at the next slide. This data highlights co-occurring disorders. In children, there are very low reports of anxiety and depressive disorders and no report of trauma or stressor disorder. In adults, there's also very low recognition of anxiety, depressive disorders, and trauma. And I'd also like you to take a look at the diagnosis of schizophrenia in adults. It is quite high compared to the known occurrence data of 3%. So since there is such a high percentage of children and adults with reported ASD, aggression, self-injurious behavior, and in adults schizophrenia, it leads us to hypothesize that there are likely underlying anxiety, mood, and/or trauma symptoms that are contributing to the presentation of aggression, self-injurious behavior, and suicidal ideation. Reported medical diagnoses are also lower than average. It's interesting because so many people with IDD and ASD have endocrine, GI, sleep, neurologic, and immunology disorders. So overall, this data does not align with our knowledge of common biomedical issues in that. This information has guided our interventions from a tertiary care perspective. Overall, they need to gather more information regarding medical and mental health diagnoses, follow up with teams, work closely with medical directors to provide training, and ask more questions when working with systems of support. It also emphasizes the importance of educating systems on mental health symptoms and how they can present in individuals diagnosed with ASD, IDD, as well as suicide prevention strategies. Additionally, we will concentrate on increasing linkages with family support networks. We'll be focusing upon diagnostic clarification and, when necessary, provide attention to self-injurious behavior and suicidal ideation. All of us at California START San Andreas would like to thank you for taking the time to listen and learn about the analysis of initial referrals at our program.